All right, thank you and welcome to Women Religious on the Front Lines, an Atla and ACWR program. My name is Todd Aiello. I'm the product specialist for Atla, and I will start by turning it over to my colleague, Head of Metadata and Editorial Operations, Jill Anito.
Hi, everyone, and welcome. Thanks for joining us today for the second annual Atla ACWR program, Women Religious on the Front Lines. As Todd said, my name is Jill Anito, and I'm head of metadata and editorial operations at Atla. I'd first like to thank Michelle Lewandowski, president of the Archivists for Congregations of Women Religious, for putting together today's incredible panel. Today's theme is taken from the 2025 National Women's History Month theme of Moving Forward Together, Women Educating and Inspiring Generations. The webinar is being recorded and will be posted on the Atla webinar page shortly at atla.com/webinars, where we will also post the presentation slides. As Todd said, if you have any questions, please put them in the chat. We'll have a Q&A session at the end. So without further ado, today we have with us Kaitlyn Griffith, archivist, educator, and project manager dedicated to preserving community histories. She serves as the archivist for the Notre Dame Sisters in Omaha, Nebraska, and manages the Faculty Organizing for Community Archive Support Initiative at Dominican University. We also have Reba Weatherford, who's the Director of Archives for the Loretto Heritage Center Museum and Archives and the Archivist for the Sisters of Loretto. She received a dual master's in Public History and Library and Information Science from St. John's University in Queens, New York. She has worked for the Sisters of Loretto in Narings, Kentucky for over 3 years and currently resides in Lebanon, Kentucky. And in a pre-recorded video, we have Kristin Barrett-Anderson, who is the director of the St. Marianne Cope Museum, started in 2014 by the Sisters of St. Francis of the Newman communities to honor their sister Marianne, canonized in 2012. Honored to share the courageous story of Mother Marianne, Kristin is working to publish the Journals of Marianne and the sisters who served with her, developing programming for caregivers and patients. So without further ado, we'll get started with Kristin's presentation.
The museum was started by the Sisters of St. Francis in 2014 to honor their sister in community, Marianne Cope, who was canonized by the Catholic Church in 2012. When you come here, you will see 2 full galleries telling the story of Marianne and the sisters here in central New York and then on the Hawaiian Islands. You'll see the reliquary that was built for her remains when she was exhumed from her grave in 2005. You will see the artifacts having to do with her life and her work. And it goes on to the programming that we do today to carry on the legacy of Marianne and the sisters. First, I want to tell you a little bit about the Sisters of St. Francis, because they are an amazing, strong, courageous, independent group of women. And they are decreasing in numbers. When I started here over 12 years ago, there were over 500 sisters, and now I believe the count is 220. They are making plans all the time for what they will look like in 5 years and 10 years and making sure that their ministries continue. What I'm presenting today is some history about Marianne and then what we are currently working on. History Part 1. Marianne and her family emigrated from Germany when she was just a toddler. They came here to the U.S. and settled in Utica, New York, just east of Syracuse. She knew at a young age that she wanted to become a sister, but agreed to stay home to help care for her younger brothers and sisters as her father was ill. The Sisters of St. Francis were a new group to Central New York, coming here to care for the immigrant communities, and most likely she met them as they were going into people's homes to care for the sick. When her father died, she was just 24, and at that time she was given permission to enter the sisters' community in Syracuse. In 1866, the sisters started St. Elizabeth's Hospital in Utica, New York. They realized that by creating a building that patients could come to, they could provide better care, more efficient care. So in 1869, Mary Ann was on the council that decided to start St. Joseph's Hospital in Syracuse, New York. Pretty early on, they realized they needed a strong leader, so they brought Mary Ann in to administrate. First, I should tell you that St. Joseph's was started with one line in the charter, and that was that they would care for every person equally, no matter race, religion, economic means, or illness. This meant that they were caring for people who were not being cared for previously. Think about people with mental health issues, with addictions, unwed mothers, and also people who simply could not afford medical care. When Mary Ann came in, she instilled practices that were not being done anywhere in the U.S. at the time: infection control and hygiene procedures and practices. She set up rules that everything needed to be washed, cleansed, hands. She was telling doctors they had to change their outfits and wash their hands between patients. This made a huge difference in spreading contagion in hospitals. Then she went to the Syracuse University Medical College and asked if their students would like to practice here at St. Joseph's. Think about it. Young medical students were graduating as doctors, never actually having been at the bedside of a patient. We all know that there are typical responses to being in a hospital bed, like anxiety, stress, fear, depression. These emotions change the way that we communicate and more efficiently care for patients. So not only were these students learning how to work with actual patients, but Mary Ann was receiving more care, more eyes, more ears for her patients. The next letter that she wrote to Syracuse University said, "Wonderful, we're going to set up a schedule for when the students can come in, but if there is a patient that doesn't want a student in their room, that's the patient's right." Now, prior to this, patients were referred to by their disease, by their chart number, by their bed number. Here are the values of the Sisters of St. Francis in action: respect and dignity for every person, especially the people who are most struggling. In 1877, Mary Ann was elected leader of her religious community. Therefore, she had to leave her post at St. Joseph's Hospital. Shortly after, she received a letter of invitation written on behalf of the King and Queen of Hawaii, then known as the Sandwich Islands, to come and care for and teach the children of Hawaii. She soon learned about the epidemic of leprosy that was devastating the islands. She learned that an exile order had been established and that a settlement for patients had been established off the island of Molokai on a peninsula that we now call Kalapapa. She agreed to go. The sisters were not convinced. She spoke with them for an hour, and afterwards, 35 sisters volunteered to go. It shows her diplomacy, which was so strong and apparent in so many of the letters that we have on file. She chose 6 sisters. They all had experience at either St. Elizabeth's or St. Joseph's Hospital. And 3 months later, they were getting on a train going across the country and then a steamship for another week to Honolulu. During that time, she set up agreements to confirm and ratify that the sisters would be in charge, that they would have help and everything that they needed to care for their patients. For the next 5 years, they cared for patients on the main islands. This was the wish on behalf of the king and queen, that the patients could be cared for closer to their homes and families instead of simply being sent off to this peninsula. They not only created hospitals, they created schools and created a home for children that were being born from the patients on Kalaupapa. As new business people were coming into the islands and taking over control and political office, they eventually stripped all the control from the king and queen, and in 1888, they closed the hospitals on the main islands. They did not want that to be what tourists saw when they arrived in Honolulu Harbor. All of the patients at that point were sent on to Kalaupapa, and the sisters went with them. Marianne lived out her life there, caring for thousands of patients coming through Bishop Home. Bishop Home was a series of homes for the patients. It was dormitories, individual homes, the convent, a medical center. It was a community, a family, a place for the patients to live a whole and complete life. To provide whole mind, body, spirit care on a peninsula in the Pacific Ocean meant they had to bring everything there so that people could have a full, whole life. All of the things that we take for granted, that we do as hobbies, that we find joy with, that we are inspired by, literature, music, history, science, crafts, they brought everything to that peninsula so that each person could live a whole, complete life. Marianne lived the rest of her life there, dying at 80 years old in 1918. Not only did Marianne keep journals, mostly administrative, of time on Kalaupapa, but she had a sister who traveled with her, Sister Leopoldina Burns, who kept a daily journal of life on Kalaupapa. Shortly after Marianne's death, the general minister asked Sister Leopoldina to take her over 40 journals and turn them into a chronological story of life with Marianne and the patients. These journals we are in the process of publishing. They show a different perspective than has ever been seen of what life was like living every day with your friends and your family dying, but also finding joy and finding meaning in your life. The sisters worked for the higher good of every single patient. This was peace before death, meeting them where they were, whatever they needed. It's an incredible story of hope and healing. We're excited to get them out into the public. What we'll see are the values in action of the sisters: respect and dignity, presence, joy and celebration. Our continuing mission today includes programming in which we take the inspiration of Marianne and the sisters and we teach practices to benefit both caregivers and patients. Some of these include empathy, taking charge of your health care, patient advocacy, relationships and developing communication skills for healing, care for the caregiver, and complementary healing practices. Please take a look at our website and learn more, and contact me at any time with any questions and I hope to see you all soon in Syracuse, New York. Wishing you all the best.
Wonderful, thank you. So we will go next to Reba.
Hello. So I'll share my screen with you and all right, thank you. And I kind of want to start by saying that the comment that I always get from the sisters here is that I speak too fast. So I try to slow it down, but then in my head, it kind of sounds like when I was a kid and the audio cassette was like broken and it was just like, anyway, so just forgive me if I talk fast and then slow down. Anyway, so thank you for being here today and for taking the time to listen to Sister Anne Manganaro's story. So Anne Manganaro was a sister of Loretto. The Sisters of Loretto were formed in 1812 in Marion County, Kentucky by three women, Anne Havern, Christina Stewart, and Mary Rhodes, at the urging of Father Charles Nearings. They were, from their earliest years, predominantly a teaching order, and from Kentucky, they spread their mission into Missouri, Colorado, Texas, New Mexico, and then other states further west and south and abroad. I could talk a lot more about this, but I'd like to spend our time on Sister Anne. So in the 1960s and 70s, while continuing to teach and operate schools, the sisters expanded their missions to include more peace and justice work. Some examples of these are sisters who nursed orphans during the Vietnam War, sisters who worked directly with migrants and farm workers, sisters that opened tutoring and learning centers, and then also they assisted local members of the Marion County community. Some sisters have worked with sufferers of substance abuse. They've done mission work in Africa. They have a mission in Pakistan and many more. So that brings us to Sister Anne. Anne was born in St. Louis, Missouri in 1946 to Frank and Mildred Manganaro. She attended Nearings Hall High School, which was operated by the Sisters of Loretto, and wrote to Loretto's Mother Superior around the time she graduated, expressing her wish to join the order. She was received into the order in 1965. So Anne was committed to community life and to teaching. She began teaching at a parochial school and then went on to teach at an experimental school known as the New City School around the fall of 1970 in St. Louis. Then in 1972, Anne founded the innovative and racially diverse neighborhood school in St. Louis. Although Anne felt her teaching work meaningful, she also had a call to work with underserved communities abroad. So in 1977, she began to study medicine at St. Louis University with the backing of her community. During this period, she also helped to establish Cairn House, which was a Catholic worker community for women and children suffering from domestic violence. Anne lived at Cairn House while she was a medical student. She completed her residency at Cardinal Glennon Hospital, working in pediatrics. In 1988, after receiving treatment for breast cancer, Anne moved to San Salvador, El Salvador, to volunteer with the Jesuit Refugee Service. This was during the latter years of the Civil War in El Salvador. For 5 years, Anne lived and worked in, and please excuse my Spanish, my pronunciation is terrible, worked in Guarila, El Salvador, which was a village established for refugees returning from Honduras. She provided medical service and taught courses on health resources. She trained the village's motivated medical assistants and healthcare promoters as well. She shared this work with other volunteers from abroad, including Susan Clausen, who is now a Loretto co-member. So the clinic that Anne helped found was later named Clinica Comunal Ana Manganaro in honor of her. And in 1933, Anne was winding down her work in El Salvador and making plans for where she would work next when she discovered that her breast cancer had returned. She died soon after in the St. Louis. She went home to St. Louis and died soon after in her mother's home on June 6th, 1993. So that was Anne's life. Now we can talk about the materials that we have from Anne in our collections and what makes her collection unique. Anne was a prolific diarist, poet, and letter writer. During her time in El Salvador, she wrote hundreds of letters to friends that she had met while serving in St. Louis. She wrote to family members and then, of course, members of the Loretto community. Even though Anne died in 1993, her materials, including much of her correspondence and diaries, actually did not come to us in the Heritage Center until about 2022. So this is because Anne had asked that her journals be left to Father John Kavanaugh. Anne and Father John Kavanaugh met while Anne worked in St. Louis, and they had become very close friends and confidants over the years. Anne asked that her diaries be left with John for him to share with others as he chose. He did share these materials. For one, he shared them with Ellen Reg Miller, who had worked with Anne at Cairn House. And Ellen had expressed a wish to write a biography about Anne. And so John suggested that she use Anne's journals and letters. So John Kavanaugh actually died in 2012, and Ellen continued to keep Anne's materials as she worked on her manuscript, and then she died before the manuscript was completed. So her husband and her friends later completed her manuscript and published it. It was published in 2022. And here it is here, Heaven Must Come to Earth. And then her husband passed on those materials, all of Anne's stuff, to Sister Marianne McGivern, who brought it to the Loretto archives. Many of her poems were written in her correspondence and journals, and she had never intended to publish them herself, but Kavanaugh had pulled many of them together in a short manuscript, which was copied and distributed amongst her friends. But a decade later, many of Anne's poems, some of which were in Kavanaugh's manuscript, but others which were pulled from other places in her writing, were published into a formal work titled Give Me a Living Love. A documentary titled Set My Hand to Hill, by a friend of Anne's named Marilyn Lorenz was released in 2014. This documentary focuses mostly on the clinic, but also on Anne's life and her work, and it does go back into her time in St. Louis and her time in El Salvador. The film is in both English and Spanish, and where English is spoken, they have Spanish subtitles, and where Spanish is spoken, they have English subtitles, so that's really cool. So the sheer amount of her writings makes her materials pretty unique within our collections. She's not the only journalist that we've had here or the only one who wrote a lot of letters, but a lot of times we don't actually get all of it. But for hers, we have a lot. While there are other, so her correspondence totals well over 1,000 pages, and her journals provide a pretty extensive detailing of her work in El Salvador and her time in St. Louis. This is one such letter here that was written in 1991 while she was in El Salvador. Interestingly, we also have a lot of the return correspondence. So because all of Anne's letters went to John, he sent with Ellen his correspondence, and then that came to us. So their letters to each other can be read often in like a back and forth fashion. And the same is true for other friends of hers who donated their letters from Anne. And also we had their letters to Anne, which came in through the materials that came in 2022. We also have roughly 600 hours of A-roll and B-roll of documentary footage from that documentary that I mentioned, Set My Hands to Hill, along with all of the filming permissions for the documentary. These materials were donated to us many years before that last donation of materials around 2022. And the footage provides testimonials, like I said, about Anne's work in St. Louis, and then of course, El Salvador. You can see here is a poem that Anne had wrote to Father John Kavanaugh while she was living in St. Louis. And this poem was later published into her poetry book. So the possible avenues for research within Anne's collection. Anne's correspondence during her time in El Salvador, obviously it's extensive and provides detailed eyewitness accounts of life in the refugee resettlement community during the latter part of the Civil War in El Salvador. She writes extensively about specific incidents and bombings that she witnessed, and writes extensively about the suffering that residents in the village were experiencing during her time there. And Another avenue for research is the relationship between Sister Anne and Father John. So as previously mentioned, Anne and John met in St. Louis, and their friendship grew into what has been described by both of them and also by others who knew them as a great love. Their correspondence and her journals provide insight into how members of vowed religious life are able to maybe navigate that kind of friendship while still remaining faithful to their vows. There's also the potential to explore Anne's work as a teacher in disadvantaged communities within St. Louis. And also her diaries definitely provide insight into being a woman medical student and resident in the 1970s in St. Louis. The last thing I'll say about Anne's materials are that having never met her myself, when you read everything that other people had written about her, you sort of get the impression that she's otherworldly. Like many people described her as an angel or a saint, and many of the writings about Anne can take on this kind of hagiographic element to them. And this is evidenced even by the title chosen for Ellen's biography about Anne, Heaven Must Come to Earth. So after reading a lot of Anne's diary entries and correspondence, I actually found her to be really human. And I remember reading about her years in St. Louis when she was 18 and 19. And it reminded me a lot of some of the things that I might have written in my diary as an 18-year-old or my friends. So that being said, Anne had a really large impact on those who knew her and many people who had actually never had a chance to meet her. One example of this is there's an employee in the archives that read her story and then was really drawn to it and felt kind of a connection to Anne and sought to just kind of read everything about her. And so I think there's potential in her materials to explore the impacts that one single life can have on so many other people, and then also to explore kind of the way that those impacts can both expand and limit how you see like the whole of a person's life. So thank you for listening to Anne.
Thank you, Reba. All right, now we'll hear from Kaitlyn.
Thank you, everybody, for coming, and also thank you to the other presenters for sharing such remarkable stories. And I want to add another one, which is the piece of the life of Reverend Mother Fabiola Ditek, who was the leader of the Notre Dame Sisters Mother House in Czechoslovakia at the time of the Nazi occupation of the state. And she was imprisoned as a political prisoner and survived the Holocaust in a very remarkable way. The materials that we have directly from Mother Fabiola about this particular period of time, it was 18 months and 11 days in total, are not very extensive. We have her first person written account, which came a couple years after she made it back to the Mother House. Also, sorry if you hear noises in the background. We're blizzarding in Omaha right now, and there's a tree that hits the window sometimes. So sorry about that. So we have her testimony, and we also have some circular letters from her written to American sisters. But as small as this particular piece of the collection is, it is absolutely full of historical value and a truly extraordinary story. In Mother Fabiola's testimony on the very first page, she says to not think of her as a martyr. She makes the point of saying more than once that others who were interned with her in Terezin and Ravensbrück had it worse. And she also stipulated that her testimony not be published. So while we have it in the archives and the sisters have made it available to researchers, it will not be published in accordance with her requests. So Mother Fabiola was born in 1885 And like I said, led the mother house during the Nazi occupation of Czechoslovakia. She was arrested on December 10th, 1943, but had previously been interviewed in November of that year regarding a letter that had been intercepted at the post office containing the names of new novices that sought to join the order. This was prohibited by the Nazi government at the time because all able-bodied adults were meant to be serving the expansion of the empire through working in factories and farming and wartime production efforts. And accepting novices was deemed dangerous to the empire. And the 3 postulants who were named were declared deserters and sent to work in factories. That was one core misstep for Mother Fabiola in the eyes of the Nazi regime. The other was the mother house itself. So over the course of the years leading up to her arrest, the Nazi regime had closed schools and orphanages and care facilities that were run by the Notre Dame sisters. And the most vulnerable amongst the populations that the sisters served through those facilities moved into the mother house with them. As the sisters lost more and more property, the German military then turned to the mother house and requested accommodation. Mother Fabiola denied this because of the logistical lack of room due to the large number of new boarders. But she also wrote in her testimony that, quote, "I could not reconcile myself to the idea of living in the same house with soldiers." So when she was arrested in December of 1943, the Gestapo ransacked her room and the rooms of other sisters from 9 a.m. to 6 p.m. Mother Fabiola, though, had burned much of the correspondence between the mother house and other houses of sisters in order to avoid storing incriminating evidence. At the end of those 9 hours, Mother Fabiola was arrested and moved to Pankratz prison in Prague. She was also held, a trial was held at Peck's Palace, where she was interrogated about her connections with anti-Nazi activities. In this piece of her testimony, her sense of humor shines through in a remarkable way. She says that the stove at the prison dated back to Marie Theresa, who was the Archduchess of Austria in 1787. She also wrote about the absurdities of the accusations that were leveled at her. She said, "That day I had hardly sat down when Mr. Commissar brought me a book of our German circular letters, which they had taken from the mother house. He had this sentence underlined in red, quote, 'We received our last letter from America by airmail across Italy and Lisbon,' end quote. He immediately added, 'For this you will get 10 years in prison.' I did not know what was punishable in this, but he went on to explain. You have some person in Lisbon and are forging some plot against the German Empire with America. And how come that you receive letters by airmail? He must have thought that an airplane from America flies directly to the mother house." She, throughout this period of interrogation, protected others by refusing to give up names and faking ignorance of information that she knew full well about. And it's at this point, with her first imprisonment, that she starts to record the names and hometowns of nearly all of the cellmates that she shared space with over the course of this year and a half, despite very traumatic conditions and experiences. Also in this picture, these are her, I believe, the clothes that she slept in Ravensbrück, and you can see her number embroidered on the breast pocket area, which also carries into the exterior clothing that she wore. In this picture, her number is there as well. The T indicates, I believe, Terezin, where she was imprisoned. The red triangle indicates that she was a political prisoner. And the purple X indicates that she was woman religious. So after her trial, she was moved to Terezin briefly before Ravensbrück. In Terezin, she was placed in the over 50 women's cell with about 50 other prisoners. At this point in time, she was 58 years old at the time of her arrest. In Terezin was when she first experienced the lack of silence and the inability to reflectively pray in silence. And this, in combination with her access to food and water, was an introduction to the conditions in Ravensbrück that awaited her. On April 20th, 1944, she was transferred to Ravensbrück. Her arresting papers that she was made to sign said that by various machinations, she prevented several persons from working for the empire, by which the German war industry was curtailed, which is true. And I think is an incredible testament to the person that she was and the order that she came from, that she curtailed the German war industry. The Ravensbrück camp, I mean, as we know, none of the concentration camps were absent of forced labor, malnutrition, and the constant threat of execution. It was there that she met another Notre Dame sister from Carlsbad, Sister Ernestine, who sought her out upon arrival when she was kept in quarantine for 5 weeks. She and Sister Ernestine spent as much time as they could together. They prayed with one another. And it was through Sister Ernestine that Mother Fabiola found out about the deaths of 2 other Notre Dame sisters at Ravensbrück, one likely from pneumonia. That was Sister Susanna, and then that was Sister Epiphania, and then one from typhus, and that was Sister Susanna. She also received food packages from Mother Celestia back from the Mother House that allowed her to trade food for other materials like warmer clothing and shoes. You can see in the picture on this slide some of the materials that she was allowed to keep, that she brought with her, that she was allowed to keep in Ravensbrück. The camp was extraordinarily overcrowded. This was towards the end of the Holocaust, and the German military was starting to panic. And so there was a lot of overcrowding. There was a lot of confusion, and that was felt by Mother Fabiola. She mentions a Mrs. Peter from Rimor, who she said protected her like a mother, who protected her from theft and from being taken advantage of by others in the camp. After her quarantine, she was made to knit stockings. And during her noon walks, she and 16 other sisters from different orders secretly prayed the Mass in a way that made it look like they were gossiping. Typhus became a big problem in Ravensbrück, as well as, of course, many other camps. And Sister Ernestine succumbed to typhus while she was there. Of the four, Mother Fabiola was the only sister to survive. Mother Fabiola, at great personal risk, snuck into the mortuary to say goodbye to Sister Ernestine and to pray over her body. You can see here this is a picture of a picture that's in our collection that shows the rosary that Mother Fabiola was permitted to keep in Ravensbrück. This is at the museum that is now at the site of Ravensbrück. So in April of 1945, a few things happened in the course of Mother Fabiola's experience. The Germans saw the writing on the wall, and they knew that the Soviets and the Americans were either in process or about to be in process of liberating these camps. And so her, along with the other women's physical fitness, was tested to see if they would be able to survive evacuation to presumably another prison under German control. She was forced to run in front of the camp commission twice to prove her physical fitness for evacuation. This was after her medical conditions had been hidden by two Czech nurses at the camp. She had a spot on her lung from a childhood bout of tuberculosis, and if it had been discovered, she would have been surely sent to the gas chamber, according to her testimony. At the age of 59, she passed muster and was assigned for transport instead of execution. On April 28th, the Germans packed prisoners into wagons in groups of 500 and walked them for a week to the town of Lubz. There, they discovered that the war had ended, and they were greeted by American troops in American automobiles that Mother Fabiola describes, who chased down and disarmed the Germans. She called their capture, quote, a wonderful spectacle. She had to find her own way home after liberation. It took her 33 days by foot, boat, and train, aided by the Russians, to reach Prague. And then a month after reaching Prague was when she finally made her way back to the mother house. She mentions her traveling companions, Bozenda Hodak and Tekla Hemelik. And once she arrived in Prague, she found the Bureau of Information and had the chief call the sisters from Ludmilla to retrieve her. Once they did, they gave her food, prepared her a bath, and lent her a habit, which she hadn't been able or permitted to wear for nearly 2 years. And after that, the first thing that she did was to go to confession, to confess her sins, so that the next day she could receive the body of Christ on the feast of Corpus Christi. She, of course, continued guiding the Notre Dame sisters, despite weighing only 80 pounds upon her liberation, despite the incredible physical effort it took her to return home. And her testimony is contained in a small number of materials, including her written story, but also letters that were written weeks, possibly days, after she arrived back to the mother house to American sisters. And they are bursting with love and gratitude and faith. It's a palpable and remarkable emotion to witness. And we have so little of her reflections. But what we do have has been more than enough for researchers to write on the life of Mother Fabiola and her experiences in the Holocaust. Mother Fabiola passed away in 1952. Her mass card you can see on this slide. She's remembered as a symbol of faith and resilience and quiet resistance. And I think that that continues to be an inspiration for our sisters throughout their missions and the ways that they carry out their work. Her testimony also mentions that there were, after the German soldiers occupied the Mother House, there were also American soldiers who boarded there as well. And there were American soldiers with connections to Omaha, Nebraska. And so they were able to pass messages through this one particular American soldier back and forth, just I think once or twice, which was such an astonishing feat because it was 4 years before the American sisters were able to get a letter from the United States to the Mother House in Czechoslovakia. So the materials that we have in our collection, like I mentioned, are the testimony and the correspondence. But then there's also research and publications and article drafts from modern scholars, both from inside the congregation and outside. Dr. Sister Sally Ann McReynolds has written extensively about Mother Fabiola. She explores feminist theology and incorporates Dolores Williams and Alice Walker into her writings. And she also duly mentions that the Notre Dame Sisters Archive is the only repository in the United States for this information, for these primary resources. The letters and testimonies from Mother Fabiola and from Mother Celestia in her absence were translated from Czech to English in 1950 by Notre Dame Sister Dolores Pavlik in Omaha. Sister Agnes Marie Ostry, Sister Dolorosa Kremlek, and also Sister Dolores Pavlik further translated circular letters in 1998 for the purpose of research. And Sister Mildred Ostry typed a lot of these translated resources, not just from this piece of the collection, but throughout the entire collection. And the story, I think, is only beginning to be told. As much as we want to, I think, respect the wishes of Mother Fabiola, there's remarkable information to be communicated and an inspiring story to be shared, the beginning of which I think has already started. So thank you very much for the opportunity, and I hope that you enjoyed the presentation.
Thank you so much. That was great. I'm so glad that we were able to have this Women's History Month panel today. I don't see any questions so far, so I'm going to ask a few of my own. So, you know, we've talked a bit about the material that are in your archives. Can you tell us about how accessible they are, perhaps online, or are there any digital archives, or, you know, maybe there are some projects in the pipeline?
I can go first.
Yeah, sure.
So for Anne's collection, no, not really. They're not online. They would need to be looked at and viewed in person. Mostly that's just because of how recently we've gotten them, just in the last couple of years. We do have almost all of our school photos and things like that are all online. We have digitized some of the publications and made those widely available. And we are looking at things we want to digitize next. We've gotten a few grants in the last couple of years to digitize records, but most of those records are Kentucky Central. So like school records from the very early years and things like that. So unfortunately hers, no, but.
Okay, great. And how about you, Kaitlyn?
Yeah, the Notre Dame Sisters have partnered with Creighton University to find a long-term solution to the custody of their archival materials. So we're in the process of making these records available to the public through Creighton's archive, also to digitizing the records with the assistance of Creighton University. And also there has been a dedicated sister, Sister Anita, who has spent many years organizing and taking care of these records. And so they are meticulously organized and they are very well kept. They are, their translations and the originals are they're incredibly healthy records. And so in the time that it will take us to digitize these records, the physical records are certainly available upon request and approval for researchers.
Yeah, we had a question from Michelle Lewandowski about accessing part of Mother Fabiola's collections. Is it available to read, or only, can they just use parts of it?
That's actually not a question that we've I've talked to leadership with yet. So I would say if you would like to put your email in the chat, I can follow up with you that way. But I want to make sure that any point of access to the archive is approved by the leadership first.
Okay. I had a little bit of back and forth with Kristin about Marianne Cope, and she wanted this information about the status of Kalaupapa and what's going on there today. And she said that even though Hansen's disease, leprosy, the epidemic ended, the exile order was removed in 1961, patients continue to live on Kalaupapa today. There are currently 4 patients still there, and although they're in their 90s, they remain in charge of the future of the peninsula. And there are 2 sisters of St. Francis that have remained there at the convent. So the National Park Service took over management of the land and buildings in the 1970s. So presumably that would be the future of the hospital there. So what kinds of challenges is your collection or institutions facing? We talked about some opportunities. What are some of the challenges that you're facing?
I can go first with this one. I think time is a big challenge, and that the Notre Dame sisters are coming to completion. So are a lot of other orders, and for this collection or this series within the collection, but also many others, there is institutional knowledge that sisters are aware of that have been passed through generations of sisters. That isn't necessarily expressly captured in the primary sources. And so trying to transfer as much of that as possible into the finding aid, into our biographical and historical notes, I think is our current challenge. But one that I am confident that we'll be able to rise to.
How about you, Reba?
So I think time too, but we have joined RAC, so the Women's Religious Archives Collaborative. Our stuff will be moving one day. We don't exactly know when, but so I think for us, it's been just a balancing act of trying to make sure that everything is like processed in a way that it can be sent, but then also balancing that with making sure that people, particularly people in this community local to Kentucky, still have access to the records that really are their family records. And so that's why our focus these last few years have been, or this last year and a half have been on digitizing records that are relevant to Kentucky families.
Okay. All right, I'll open it up again for questions from our attendees. And I'm sure our panelists are open to getting questions by email if anyone has anything else. All right, let's see. All right. Well, I want to thank everyone for joining us today for Women Religious on the Front Lines. Sincere gratitude to our guest speakers for sharing their experiences with us, and thank you to our attendees for joining us. And you know, it's great to have the kind of attendance and engagement that makes these webinars really fun to put on. And it's, you know, we hope to do this every single year. And if you have any feedback, we'd love to hear from you, and we will be sending out a survey after today's webinar. If you'd like, we have a lot more webinars and resources on the horizon at Atla. It's atla.com. So please keep an eye on our website and social media for updates. Thanks again for joining us, and we hope you found today's webinar informative. So until next time, take care and goodbye.